So, let's talk about pain off. This medication is a combination of aspirin, acetaminophen, and caffeine. It is used for temporary relief of pain from conditions such as muscle aches, toothaches, menstrual cramps, or headaches, including migraine. Aspirin and acetaminophen work by preventing your body from producing certain natural substances that cause pain. Caffeine helps to enhance the effects of aspirin and acetaminophen. It's important to follow the recommended dosage and take pain off at the first sign of pain for the best results. Always consult with a healthcare professional before starting any new medication. If you are using pain off as an over-the-counter product, be sure to read all directions on the package before taking the medication. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, take it as directed. Take pain off by mouth as directed by your doctor, or follow the product package directions. Drink a full glass of water with this medication unless your doctor directs you otherwise. If you are using the tablet form, do not lie down for at least 10 minutes after taking it. If upset stomach occurs, you may take it with food or milk. The dosage is based on your medical condition and response to treatment. Do not increase your dose or use this drug more often or for longer than directed. Do not use this product for pain lasting longer than 10 days or fever lasting more than 3 days. Use the smallest effective dose. Consult your doctor or pharmacist for more information. For those taking pain off as needed, remember that pain medications work best if they are used as the first signs of pain occur. If you are taking this product for headache, get medical help right away. If you also have trouble speaking, weakness on one side of the body, sudden vision changes. Before using this product, consult a doctor or pharmacist if you have daily headaches, your first headache after age 50, a headache that is more severe or different from your usual headaches, headaches caused by head injury, coughing or bending, a headache with vomiting, fever and stiff neck. Consult your doctor or pharmacist if your migraine headache is not relieved, or if it worsens after the first dose. If you are using pain off for migraine attacks on 10 or more days each month, the drugs may actually make your headaches worse. Do not use medications more often or for longer than directed. Tell your doctor if you need to use this medication more often, or if the medication is not working as well, or if your headaches get worse. Consult your doctor if your condition lasts or gets worse, or if you have new or unusual symptoms, redness or swelling of the painful area, pain or fever that does not go away or gets worse. Some common side effects of pain off include nausea, vomiting, stomach upset, trouble falling asleep, or a shaky/nervous feeling. If these effects persist or worsen, it's important to notify your doctor or pharmacist. If your doctor has prescribed this medication, they have determined that the benefit to you outweighs the risk of potential side effects. Many people using this medication do not experience serious side effects. However, it's important to stop taking pain off and contact your doctor immediately if you experience severe stomach/abdominal pain, severe dizziness, fainting, vomit that looks like coffee grounds, black/bloody stools, ringing in the ears, loss of hearing, irregular/fast heartbeat, signs of kidney problems, or easy bruising/bleeding. While a serious allergic reaction to pain off is rare, seek medical help if you notice symptoms such as fever, swollen lymph nodes, rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects, it's important to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you may report side effects to Health Canada at 1-866-234-2345. Acetaminophen is the main ingredient in pain off. It's important to be aware that taking too much acetaminophen can lead to serious liver disease, and adults should not exceed 4,000 milligrams, 4 grams, of acetaminophen in a day. For people with liver issues and children, the recommended dosage is lower. It's crucial to consult your doctor or pharmacist to determine the safe amount of acetaminophen for you. It's also important to note that pain off should not be taken with any other medication containing acetaminophen without consulting a doctor or pharmacist first. Acetaminophen is found in many over-the-counter and prescription drugs, such as pain relievers, fever reducers, and cough and cold medications. Always check the labels of your medications to see if they contain acetaminophen, and ask your pharmacist if you're unsure. In the event of an acetaminophen overdose, seek medical help immediately, even if you feel fine. Symptoms of an overdose may include nausea, vomiting, loss of appetite, sweating, stomach pain, fatigue, yellowing of the eyes and skin, and dark urine. It's important to avoid daily alcohol consumption, especially when combined with acetaminophen, as this can cause liver damage. Before taking pain off, talk to your doctor or pharmacist if you are allergic to it, aspirin, other NSAIDs, or other salicylates, acetaminophen, or caffeine. Also, discuss any other allergies you may have. This product may contain inactive ingredients that could cause allergic reactions, so it's important to talk to your pharmacist for more details. Before using pain off, tell your doctor or pharmacist your medical history, especially if you have asthma, certain blood disorders, bleeding or blood clotting problems, ulcers, gout, kidney or liver disease, growths in the nose, anxiety disorders, insomnia, heart disease, high blood pressure, or stomach problems. Also, make sure to let your doctor or dentist know if you are using this medication before having surgery or certain medical procedures. Be cautious of daily use of alcohol and tobacco while taking pain off, as it may increase your risk for stomach bleeding. It's best to avoid alcohol and stop smoking while using this medication. Older adults may be more sensitive to the side effects of pain off, especially stomach/intestinal bleeding and ulcers, liver problems, and trouble falling asleep. Children and teenagers under 18 years old should not use aspirin or aspirin-related medications like pain off for flu symptoms or chickenpox without consulting a doctor first, as it may cause a serious illness called Reye syndrome. Women of childbearing age should talk with their doctor about the benefits and risks of using pain off. It's important to inform your doctor if you are pregnant, plan to become pregnant, or are breastfeeding, as this medication may harm an unborn baby and cause problems with normal labor/delivery. It is not recommended for use in pregnancy from 20 weeks until delivery, and if your doctor decides that you need to use this medication between 20 and 30 weeks of pregnancy, you should use the lowest effective dose for the shortest possible time. Additionally, pain off passes into breast milk and may have undesirable effects on a nursing infant, so it's crucial to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could affect how pain off works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with pain off include acetazolamide, cimetidine, corticosteroids, ketoconazole, methotrexate, mifepristone, medications for gout, anti-seizure drugs, and vemurafenib. If you have recently received certain live vaccines, consult your doctor before using pain off. Taking pain off with other drugs that may cause bleeding, such as antiplatelet drugs or blood thinners, can increase the risk of bleeding. Also, be cautious when taking other pain relievers/fever reducers, as they may increase the risk of side effects when taken together with pain off. If you take low-dose aspirin for heart attack or stroke prevention, continue taking it unless your doctor instructs you otherwise. Lastly, pain off may interfere with certain lab tests, so make sure to inform lab personnel and all your doctors that you use this medication. If someone has taken too much pain off and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can reach your local poison control center at 1-800-222-1222. Canadian residents should call their provincial poison control center. Symptoms of an overdose may include nausea, vomiting, loss of appetite, sweating, burning pain in the throat and stomach, stomach pain, extreme tiredness, yellowing of the eyes or skin, ringing in the ears, rapid or shallow breathing, irregular or fast heartbeat, changes in urine output, dark urine, confusion, agitation, seizures, or loss of consciousness. When using pain off, it is important not to share this medication with others. If you are taking this medication regularly for a long time or at high doses, your doctor may want to monitor your liver and kidney function through lab and/or medical tests. It's important to keep all medical and lab appointments and consult your doctor for more details. Since pain off contains caffeine, it's best to avoid taking it close to bedtime as it may make it difficult for you to fall asleep. It's also a good idea to limit the use of other caffeine-containing medications, foods, or beverages while taking this product. Consuming too much caffeine can lead to feelings of nervousness, irritability, trouble sleeping, or a fast heartbeat. If you are using pain off for headaches, it's recommended to avoid certain foods that may trigger your headaches. Additionally, making lifestyle changes such as participating in stress reduction programs, engaging in regular exercise, and making dietary changes may help prevent headaches. It's a good idea to talk to your doctor or pharmacist about lifestyle changes that might benefit you. If you are taking this medication on a regular schedule and forget to take a dose, take it as soon as you remember. If it is close to the time for your next dose, skip the missed dose and take your next dose at the usual time. Do not take a double dose to make up for the missed one. Remember to store pain off at room temperature, away from light and moisture. Keep it out of the bathroom and away from the reach of children and pets. Do not flush pain off down the toilet or pour it down the drain unless instructed to do so. When pain off is expired or no longer needed, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call fdae 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.